You know, my primary advice is stay in training, always be learning about how to more effectively work with children. I would highly recommend being well versed in play therapy. If you want to sit and talk and verbally process, then you probably need to work with adults or older adolescents. You need to be able to get on the floor, you need to be able to play games, use puppets, dolls, art, all of those things. And there's great training out there that teaches you how to think developmentally appropriate for the children, but also be really creative and really be able to engage the children in the therapeutic process or mentoring or teaching or whatever process it is that you are engaged in. So always stay in training. I also really recommend having a really good foundation in family systems so that you can look at the big picture with the children, look at how their system functions, and look at the places where the system maybe is keeping the child from reaching their full potential. In that, you're also going to have to be really good at working with adults. When you work with children, it is one of the primary areas where you have to be able to work with everyone in the system. And so my personal favorite when working with parents is using motivational enhancement therapy, because a lot of times we just find parents, they want to be good parents, they want their children to succeed, but they just don't know how to get there. And so really being able to work with the parents on finding the motivation to do the really hard work to help their children change and grow and succeed, I find that to be very helpful.
One of my advice things would be is to make sure I use the term validating the client and the families. So oftentimes children present strong emotion and they're told that it doesn't necessarily matter how they feel, they need to act differently. And so oftentimes when you see a very strong emotion, to validate that emotion and help them understand that it's okay that they feel that way. If they feel that strong emotion, to not fight it, but to understand it and really learn to manage it in a different way. So, and I would say the parents as well, a lot of parents fight guilt and they really struggle with what to do and not having the skills that they need to have to manage a difficult child. So, to validate those feelings and help them understand that you're not there to blame, you're not there to point a finger, you're not going to be one of those people in their lives, but you're there really to kind of come alongside them and work through what they need to work through to really get to a better place and to provide that hope for them. Because oftentimes I think if you validate someone, you really can bring hope into their lives. So I think validation is a very important part of that. And then also, as my colleagues had presented, definitely keep learning. Every opportunity you get to learn something new, because it will bring a new aspect, a new facet to what you're trying to teach, the individuals you're trying to teach. And I am a big proponent of talking to each other and learning from each other. So someone who's been in the field a year will have something to present to someone who's been in the field for 15, 20, 30 years and vice versa. So learning from each other and really understanding how to meet the client in different aspects.
Some advice I would give to you as a student who would be working with children is to see the big picture of their life, know their environment, know their developmental age, know your limits, and be able to learn more and more as a professional caregiver to gain the knowledge you need to continue to work with children, particularly if that's your desire. To bring in the parents, because oftentimes you'll find that it's not always the child. Oftentimes it's the parenting issue that goes with it. So family systems can be a very, very important factor in counseling with the child. Also know their environment. Also know, what I mean by that is their diet, for example. If they have high sugar intake, they could be challenging in that respect with high energy. Know that by just sitting with you in your office may not be the most acceptable environment for the child. So think about taking them outside, walking around the parking lot of your practice. If you're in a church setting, perhaps you're adjacent to a playground or to a park, and spend some time allowing them to expend their energies. And at times, by doing so, they may feel more at ease and more compelled to share their story.